A real human suffering. I'm sure you know we've come across this before, but every time it happens, it's
you can't brace yourself for what you hear. It's harrowing. It's absolutely necessary that we hear this, and that more people hear this. I said to some of your colleagues earlier on that,
I mean, we're here today to listen to the harrowing testimony from medics who have worked in Gaza, and to be reminded of the UK's legal, moral and ethical responsibility to help these children. We are essentially supplying the means of delivery which are killing and maiming them, and yet we are denying these children medical care here in the UK.
Children who've been born or have had complicated pregnancies, their mothers.
We're here today lobbying MPs, really speaking about the crucial obligation that the United Kingdom has to save Palestinians and Palestinian children, providing them with aid, with relief, with essential health care, really in support of the genocide that is ongoing in Gaza. I think we have seen starvation, displacement, eradication of Palestinian children that goes very much against international law. And the UK is not only funding that assault, but it is now disallowing any sort of survivors of this atrocity to receive medical health care.
I'm sure everybody on the panel will be very welcome to hear.
10 years through his BSc, his Masters in Public Health. He's helped Dr. Philippa Whitford, the SNP politician, to improve the breast cancer pathway, and has got work in publication. And this is Chris Lockyer, the Director of Médecins Sans Frontières.
I have been supporting colleagues in Gaza since October the 7th with multiple MDT meetings, advice, and trying to help them to deal with the injuries, most specifically to young children, abdominal trauma, and helping to assist them in them being evacuated, but then trying to get supplies to these children in Egypt.
Help provide safety, health and health services to children, as well as an adequate standard of living.
I'm sure everybody on the panel will be very welcome to hear.
Members of Parliament are completely sympathetic and anxious to help.
So I don't understand the hesitation.
I'm one of the doctors who is currently lobbying our government and our MPs in the Houses of Parliament to allow Gazan and Palestinian children into UK for their urgent and life-saving and limb-saving surgeries and the medical treatments that they cannot get anywhere else, simply because it is a humanitarian and the kind thing to do, and it works with the British values of equality, of sticking to our principles and sticking up for the underdog. That is why I'm here speaking to our MPs today.
Help provide safety, health and health services to children, as well as an adequate standard of living.
It's been over a year and we've seen over 43,000 people killed, 70% of them women and children. Something needs to happen. We've heard ministers and David Lammy talk about urging the Israeli government in terms of restraint and complying with international humanitarian law, but that's fallen on deaf ears. So we need more decisive action. I believe that we need an immediate ceasefire.
It's a miracle that she survived, that she has now, at 5 years old, been thrown into the world of refugee tents, of looking to survive day by day.
I myself, as a Palestinian from Gaza, have suffered great losses. Over 200 relatives of mine have been killed by the ongoing genocide, most of whom were women and children. By what definition should they not be allowed treatment? Every human should be allowed treatment. So thankfully, the members of Parliament that we spoke with have showed great interest in pushing for this campaign to go forward, because we've seen European countries bring in evacuated children from Gaza. We've seen them treat them because there is specialist surgeries required that the UK can also provide. This is not a difficult ask. but rather the basic and humane ask of the government.
I think if we're coordinating what we ask in that UQ, it could have a lot of power and pressure and leverage as a result of that.
Clear that these are not charitable obligations. These are legal, political and reparative obligations that the British government owe the people of Palestine, and specifically Palestinians living in Gaza at this particular moment in time.